This segment is sponsored by iChiro Clinics and Peak Performance Integrated Medicine. After 30 years and thousands of patients, Dr. Michael Quast has come to an understanding about lower back pain and what is predominantly the cause of it. And Dr. Quast is here now to talk about that. Lower back pain, Dr. Quast, it's one of those things that really impacts your quality of life. It kind of colors everything about your day, doesn't it?
Yeah, a lot of people are impacted by that. And a lot of treatments that we've done for decades, and many providers for decades, have all been to the lower back. And what we're finding, just after years and years of observations, is that most people with lower back problems, it actually comes from restricted hip mobility.
Which seems so odd to me. Like, how could that be?
Yeah, so when your hips don't move, then when you bend and you lift and you do things, you're not using, your hips. You always hear lift with your legs, right? We've always heard that,
Yeah.
um, not your back. Well, that's hip mobility. And so people will lose this hip mobility, but because their hips don't hurt, they don't realize that the hips are the cause of what's going on. And so
Mm.
then when you bend and you do things, you won't know that your hips don't move because your brain just makes a new compensation pattern for you. And now you'll just bend and do the movement, and then your back is the one that's taking the brunt of it, and then the back strains, it pulls, it ruptures discs, it has all these problems that happen when really the cause of it is coming from that lack of mobility in the hips because they're not doing their job.
So when someone comes to you and says, I've got lower back pain, you do hip range of motion testing, right? And what does that entail?
Yeah, so it's very simple, just some hip range of motion. How far does your hip bend and move? And then we do some orthopedic tests on that as well. And those tests, they will tell us how well your hip is functioning. We do those tests for the back too, because once in a while it'll actually be coming from the lower back, but usually not. Usually it's all coming from those hips.
Mm.
And then we can identify where those problems are in the hip motion and then put a rehab plan together to actually fix that. And because we do the testing before and measure, then you can do your treatments and then you can remeasure and then you can see if you're making progress, how much progress you're making, and what's happening. Not only for us to be able to tell a patient what they should do, but for the patient, they always know where they're at. So if they're wondering, I don't know if this is working or not, they don't ever say that because all you have to do is look at your mobility test. And if the tests are improving, you're doing better. Because bottom line is when your function improves, you're never losing. You're
Mm.
always winning when your mobility and your function gets better. So with the back, that's going to reduce your chances of having injury, but it also will reduce the chances of having arthritis and degeneration in those joints as well.
You said to me, you're simply trying to make people more durable. You want the body to hold up for them.
Yeah, the models have changed. We've talked about this. We used to just chase symptoms, right? And people were just take all these drugs, and mask how you feel. And then, now everybody knows that's a really bad approach. It's better to get to the cause of it. And so what we're finding is it's not about chasing symptoms. It's about how do we get you to your casket with great mobility. And the word is durability, right? How do we make you as a person more durable so you're hard to hurt, you're hard to injure, that you're functioning at a high level and doing all the things you want to do right up to the day you just drop dead? Isn't that what everybody wants? And with our testing, we can determine that and raise your durability by making sure we're measuring and checking everything so that you know what things to actually do. Because what happens is people just go to the gym or they do like the random stuff and it's not specific to their immobilities. And so a lot of times they're just wasting time, right? They're wasting time in the gym. They don't realize that they could be more effective if they could focus in on where those immobilities are. And the only way they know is if we measure and look at them. And then that way they can target those exercises and stretches right to where their personal immobilities are with measurements so that you can remeasure and track that progress.
Over time. All right, folks, if you want to join Dr. Quest's army of durable people, let's do it. Give them a call to book an appointment, 616-447-9888, 447-9888, or visit peakperformanceintegratedmedicine.org. Thanks, Dr. Quest.
Thank you.